In this video, we will discuss the following. What is inflammation? What is the connection between inflammation and aging? What is the connection between inflammation and chronic diseases? This channel provides the most authentic and comprehensive information on health and medicine. Only the most trusted and standard sources are used for research. What is inflammation? Inflammation is the response of the body to a number of external unfavorable factors. Examples of these factors include infectious microbes, injury, burns, etc. In inflammation, a number of cells including phagocytes like leukocytes and macrophages reach the site of inflammation. They secrete various chemicals like interleukins and others, and try to clear the triggering agent. When the triggering agent is cleared, cells and mediators secreted by these cells bring about the resolution or clearance of the inflammation itself. Inflammation is a delicate balance between substances that drive inflammation, and later on, substances that halt inflammation. In some cases, the body is unable to clear the triggering agent completely. In these cases, low levels of the triggering agent and inflammatory cells and chemicals continue to persist at the inflammation site for long periods. This is known as an unresolving inflammation. This local inflammation present in one organ can spill over to multiple organs, and become what is known as a systemic inflammation involving the entire body. This chronic, systemic, and low-grade inflammation is asymptomatic, and the person having it is unaware of this inflammation going on inside his body. What is the connection between inflammation and aging? Inflammation is usually beneficial as it helps to protect the body against a number of external factors. However, it can become the reason for harm to the body when it is unresolved and persistent for long periods. Inflammation is present in a number of chronic diseases. It is also a common feature in the process of aging. It is observed that older people have higher baseline levels of inflammation, which is evident from the fact that they have higher levels of inflammatory markers in their blood like C-reactive protein or CRP, interleukin-1 beta or IL-1 beta, interleukin-6 or IL-6, tumor necrosis factor alpha or TNF-alpha, and others. This higher baseline inflammation in the elderly is called inflammaging. Inflammaging, in part, is due to immunosenescence. That is to say, that as people get older, their immune system also becomes old and less efficient in clearing the foreign agents like antigens. This causes prolonged lingering of those foreign agents in the body, causing chronic low-grade inflammation. What is the connection between inflammation and chronic diseases? Inflammation is associated with many age-related chronic diseases. Some of the most common ones are discussed here. Inflammation is seen in atherosclerosis, Bourne et al., 2004. Atherosclerosis is a condition in which there is formation of plaques in the arteries supplying blood to organs like the heart and brain. These plaques can complicate suddenly, resulting in heart attacks and strokes. Inflammation is also seen in hypertension, Miguel et al., 2015. Hypertension is a condition in which the blood pressure is higher than normal. Inflammation is present in type 2 diabetes mellitus, Franceschi et al., 2001. Diabetes mellitus is a condition in which glucose levels are chronically high in the blood. Persistent high levels of glucose eventually cause damage to organs like eyes, kidneys, and blood vessels. Inflammation is seen in conditions like Alzheimer's disease, Junta et al., 2008. Alzheimer's disease is the leading cause of dementia, and is responsible for decline in memory and functioning with age. Inflammation is a feature in osteoporosis, Lensel et al., 2011. Osteoporosis is the leading cause of fractures in the elderly. Inflammation is present in many types of cancers, Singh et al., 2019. Inflammation is also seen in frailty, Lang et al., 2007. Frailty is a condition in the elderly characterized by weight loss, weakness, reduced physical activity, reduced grip strength, slowness, and most importantly, inability to cope with acute stressors like infections, trauma, etc. Frailty is due to physiological aging in various organ systems. Finally, obesity is a condition in which there is low-grade inflammation, Lee et al., 2013. However, it is still unclear whether inflammation is responsible for causing these diseases, or there is merely an association of inflammation with these conditions. If you liked this video, please push the like button. If you want to watch many such videos in the future, don't forget to subscribe to our channel, and push the notifications bell. If you would like to watch any particular videos in the future, let us know in the comments section. Bye, and have a nice day.